Thank you for joining us today. I'm going to be sharing with you a little bit of my personal story. Since I am not an expert in this field, I am an interpreter, but my son was diagnosed with autism in 2014. This is a little overview of the topics that we're going to cover. Because there are some different terms that can be a little bit confusing, and there will be a lot of specialists that you will be interpreting for. And this, my personal experience inspired me because I thought how difficult this would be for an interpreter that is not familiar with a topic. For me, was not that complicated because I go to all these meetings with a specialist as a parent myself. A little information about me and my son Marco. We moved to Scotland in about 12 years ago. My son is now 13. He goes to a special education school. He's currently in the second year of high school. He's an S2. He was diagnosed in 2014, but we noticed some changes in him when he was around 2 years old. I took him to the GP for another health issue. And around that time, my son had 20 words, more or less, but he never put those words together. He didn't speak in phrases. And I told the GP that I wasn't concerned because my idea was raising him bilingually. I wanted to keep talking Spanish with him at home, and he would learn English at the nursery school. And he said that anyway, he was concerned about this delay in the language, and we were referred to a pediatrician. Later on, when I educated myself, I realized that my son, what he was doing, he was repeating words, and this is referred as echolalia, which well, the word itself, it gives you a clue because it starts with echo. He was echoing the words, but he didn't understand the meaning of them, and that is normally the first sign. It's a complex condition, autism, and I believe that we all keep questioning ourselves, what is it? And even the specialists, it's a lifelong condition, and it affects the way that a person would develop, that would interact with the world and others. It is referred as a disorder because it's not a disease. It's not something to be cured. And you might be wondering, what is it right to say? Is it person with autism or is it autistic? From a grammatical point of view, they are both correct. But people that are autistic, that are high functioning, they would prefer autistic because they say that if we say person with autism, we're implying that it's a person that has a disease. These are the main characteristics about how autism affects a person. Difficulty processing the stimuli from the outside. Well, this actually has a name, and it's called sensory processing disorder. The stimuli from the outside world can be anything. Can be a sound, can be the way that your clothes feel on your skin, the smells, the colors as well. There is a way that autistic people have to cope with all this sensory overload. That is called stimming. Stimming is is a self-stimulatory behavior, and this takes place in form of hand flapping. It could be singing, it could be jumping, rocking back and forth. It shouldn't be stopped because it's a way that the person has to cope with it, to deal with all that sensory input and creating an output. The problem is when the stim is dangerous. For example, excessive nail biting or grinding teeth. And in those cases, it should be stopped. Restricted interest is incredibly common, but this could actually be seen as a strength because, for example, an expert in any topic would be always on demand. And this is something that we should see as a strength, and especially when there are some educational arrangements to be done for a person. This doesn't have to be necessarily something bad. Then we have the communication impairment. Some autistic people, they never develop language, just like my son. My son, when he was around 2.5, he lost those 20 words that he had. He had a regression. And now he's 13. Sometimes he says some loose words, but it's the main area of difficulty for him. And some people remain nonverbal. It is not uncommon at all. Demand avoidance means not following demands or instructions, and that is a challenge to organize education because these behaviors can interfere with the learning. And challenging behavior as well, it's linked to demand avoidance. Basically, a child would look for any sort of resources to not follow a demand, would do something that they know that they shouldn't be doing, but they do it anyway. But behavior is quite complicated because behavior serves a function, and it could be even biological. It could be a health issue. A child that is nonverbal and is having a stomach ache and can't communicate that feels frustrated, and then the challenging behaviors start. Sleeping difficulties are very common. Normally, the pediatrician would refer the child to a sleep clinic, but they don't have the study in the clinic. It's more like the clinic is giving some advice about good sleeping hygiene, how to prepare to have a good sleep. And it's not uncommon to the children to be prescribed melatonin. That there are two types. There is a slow release, that is to fall asleep, and the slow release, it is to stay asleep, because it's not uncommon that they will wake up several times during the night. And there are two reasons for these sleeping difficulties. It is a lower production of melatonin, that is the sleeping hormone, and also that inability to switch off and go to bed to sleep. Then you will hear a lot about sensory issues that could range from the feeling of the clothes on the skin to the diet as well, because there are autistic children that they eat by color, by texture, that smell, because they have this difficulty processing all these sensations. There are some comorbid conditions that these are conditions that come with. They are not caused by the autism, but they come with. It's not uncommon. For example, ADHD. ADHD normally happens in children that are autistic and also have a learning disability. And that is a problem, because a good therapy for ADHD is a cognitive behavioral therapy, but this kind of therapy involves speaking, and most of these children will be non-verbal, so they can't do this therapy, and there have to be other ways to manage the condition, which is it includes impulsiveness, short-term span, short-term attention span. My son, for example, he wouldn't stay still for a second, and this would interfere with his eating, with his learning, and also it would lead to bad behavior, because he couldn't control himself. He was very impulsive, had no sense of danger at all. But it is difficult to get a diagnosis, because it's always assumed that it's a comorbid condition. So I had to push for this diagnosis. Epilepsy, it's a complicated condition to manage, because the children will have to attend to a specialized school where the staff are prepared to deal with an epilepsy episode. Even the bus transport, they have an escort, and the escort should be prepared. There has to be a plan for epilepsy in place for this. But the special education schools, they are really good. They have disability nurses, and they work very closely with the NHS. Then we have ARFID, that it's a condition that the specialists didn't know much about. This classification started in 2013, and it is an eating disorder, and it's the acronym means avoidance restrictive food intake disorder. And this is completely different than the other disorders, eating disorders, such as anorexia and bulimia, because it is not about a person worrying about losing weight or about the way they look. It is more linked about the processing these sensations from the food, right? Like the smells, the texture. There might be a fear of choking. It's almost like fear of food. And well, it's very interesting that now the specialists know more about it, and they are doing more research, because my son has this problem, and I always wondered if it was an eating disorder. And of course, it's very worrying when a child doesn't eat, because he's growing. He needs to have energy. He needs food, and it's incredibly complicated. But the camps, they help with this. They go to a school, and they do a therapy to improve this issue. Being autistic doesn't mean that a person will have ARFID or epilepsy. It means that it's with the epilepsy, it's an increased risk. Not all the autistic children have it. And ARFID, it is possible to have ARFID and not be autistic, and there is autistic people that don't have it either. Gastrointestinal issues, they are very linked to the diet. Unfortunately, it's not uncommon to have constipation, and there are studying the links of the intestines with autism, because it's so common that they have issues with this. And one reason might be the diet, because, for example, not drinking much, and the restrictive intake of food as well. That could be what causes the constipation. these are the four main types. That this is constantly changing, because, for example, Rett syndrome is genetic and it affects mostly females. It's not exclusive of females, but it has been excluded in the new criteria for diagnosis, same as Asperger's syndrome. It's not going to be included, but people that already have the diagnosis, they still identify with it. There is a lot of controversy around the name of the syndrome that I'm going to go into that later. The childhood disintegrative disorder is something that is really it's more uncommon, really, because that's a late onset, and it starts when a child is about 4-6 years old, and they lose their capacity to speak, their abilities. It's a regression, and it's more uncommon. The most typical type is PDD NOS. That is, it would be the classic autism. So, well, the first person that observed autism was Leo Kanner, and but his theory was a little bit controversial, because he claimed that autism was caused by mothers that were not affectionate with their children. He focused more in the type of autism that comes with a learning disability, and children that are non-verbal, that have repetitive behaviors. That is what he was more interested in studying. So that's why they used to call it Kanner's autism, to differentiate. But yeah, this was in the decade of the 40s. It was a long time ago. And I didn't mention that before, that we talk about autism as a spectrum because it affects people differently. It can be very disabling for some. For example, my son is never going to be able to live independently. And I was told that because when he's 16, he's going to be an adult, I need to apply for guardianship for him to make decisions on his behalf, because he won't be able to live on his own and nor manage money or care for himself. Hans Asperger, he focused more, and that's why, well, they gave the syndrome his name, because he was the one that observed it. It's a high functioning type of autism. There are people that are highly intelligent, but they struggle with social interaction and social norms. As I mentioned before, it's going to be excluded, but some people that already have a diagnosis, they still identify as someone with Asperger's syndrome, and but others don't want to, because this doctor, he was a psychiatrist from Austria, and it is there is evidence that he had some links to the Nazi regime. So that's why a lot of people that have Asperger's syndrome, they don't say it anymore. Dr. Temple Grandin probably is the person with Asperger's syndrome, the most famous person. She's a huge advocate for people on the spectrum, and her books are really good, especially for parents like myself, because she has ways to, for example, there's a book that's called The Loving Push. In that book, she explains like how a parent can encourage the child to be a little bit out of their comfort zone, but to help them to progress, to develop more skills, but without upsetting them or creating a trauma in them. She came and gave a fantastic talk in Scotland and was talking about a therapy that's called sensory enrichment therapy, which is it's aimed to help the children with the sensory issues. And it's a fantastic way that parents have, because it can be done with very cheap items in the house. For example, my son likes that I spray lavender in his pillow. That helps him to sleep because he likes the sensations that come from the smells, and it would help him to tolerate other sensory input. For example, I don't know, the smell of the food. It's a way to overcome that. There is a bias because we always say that it's more common in males, but there are women that might go during their whole life undiagnosed. And that is a term that you will be hearing that is called masking. So they act in a certain way to be accepted by other people. Neurotypical, it's a person that develops in the typical way. And masking is just that, basically trying to fit in. That can be actually traumatizing. It can cause the person to have an anxiety or depression. Now we're going to see the difference between learning difficulties and learning disabilities. Dyslexia, for example, it's a difficulty with literacy. It would be spelling, reading. ADHD is attention deficit hyperactivity disorder. That in America, it's called ADD, attention deficit disorder, which it's quite curious because a person can focus in something that they are really interested in, but they might struggle with procrastination, or there's people that have very creative minds and they are quite brilliant indeed. It's not something that could be disabling, although in America it is considered to be a disability, but not in the UK. Dyscalculia, it's problems with arithmetics, for example, counting backwards. It's a problem with numbers. The main difference with between the learning difficulties and the learning disabilities, it is that the learning disabilities affect the intellect, while the learning difficulties don't. It can be something that gets in the way, but it's not. It doesn't mean that the person has a lower IQ or can manage tasks of daily living, for example. Managing money, personal care. So that's the difference between the two of them. The road to diagnosis, it can be quite long. First, it's the hearing test, because normally what the specialists notice is that a speech delay, and therefore they have to discard that the child has some hearing issues. And it's very different than it would be with an adult, because an adult normally would go to a test with a headphones and a computer, and they have to push a button when they hear a vibration or a sound. But with a child, you need to get a little bit more creative, especially a child that is non-verbal and won't follow directions. So we were taken into a clinic that there were boxes with lights and toys that came up, and they would see when my son was turning his head. Then there are questionnaires that are filled by the pediatrician, the GP. Normally, it could be the nursery nurse at the school and the parent. So they compare how the child behaves in different settings. Then the official diagnosis it's in a pediatric clinic that in Scotland is called community child health. In the communication clinic, there will be two psychologists, and the parent needs to attend with a child, and it's a very long list of questions about the child's behavior. And normally, if there are doubts, they could record the session so they can discuss the behavior of the child with other specialists. But it's not that common. It's in some certain cases. The criteria used, it's the Diagnostic Manual of Mental Health Disorders, DM5. Previously, there was a DM4, and well, because this is updated, the criteria for diagnosis, it's being refined all the time. And IC10 was before. The UK, it's implementing the IC11. It was being implemented this year because normally they follow what they do in America. And yeah, it didn't change the paradigm very much. And IC, it stands for International Classification of Diseases. It's a guideline. This was what we were talking before. Learning disabilities. Well, the autistic people that have learning disabilities, they could be labeled as low functioning. The specialists don't like that because high functioning people are not less deserving of support. But unfortunately for a parent, it's we need this label. We need this label to get the right level of support. There are different policies to make education arrangements. In Scotland, we have getting it right for every child, and that means that the local authority, they have to make arrangements to organize education for this child according to what their need. I found that there is in England and Wales a similar policy, but well, from a legal point of view, the act looks a little bit different. The section 23, it's an act that a parent would have the right to ask the social work department for an assessment of the needs of the child. And what they do is that they allocate a budget. And this budget, it could be used for activities that will encourage the development of the child. For example, my son goes to a social skills club twice a month. Then he goes on respite care, that he spends an overnight away once a month. And he has also a holiday activity program that is like a school day. It's the same people that do the Saturday club that he goes to. And well, it gets him less stress because he loves routine and and school. He likes his life to be predictable, and they do fun activities. They go to museums, they go to the zoo, and they they have someone that comes in to do some music therapy with them. It's really nice. But other parents might choose to do something differently with that money. For example, hiring a personal assistant that would give them a little break. They can take the child for an outing, or they might hire a cleaner because they are exhausted, and that's what helps them. Or they might choose using the money to pay for different therapies if they wish. They need to have a separate bank account for that. We'll talk a little bit about additional support for learning that can be delivered in different ways. For example, a mainstream school, and the child has, for example, a person to support them for a couple of hours, and that's called one-to-one support, as opposed to saying one-on-one. It is just to say, for example, I spend some one-on-one time with my child, and that means that we had some quality time together. But one-to-one, it refers to the ratio of support. Because of his behavior, my son needed one-to-one for a long time, because he was a danger to himself and to others. He actually was expelled from a private nursery that he used to attend. And because his behavior was so difficult in the nursery school, they could only have him for an hour and a half. And then I complain about that because all the other children will get 3 hours. And that's the law in Scotland, that the children get 3 hours of nursery. So I argue that, and I finally got them. Some children that attend mainstream schools, well, that they can be in a classroom that is quieter, for example. But it can be very difficult. There are some children that really struggle in mainstream school because there is nothing in between the special needs school and the mainstream. The problem is that some children can be bullied because they are autistic, and they are masking to fit in. It can be very problematic. Additional support for learning is not only for children that have a disease or are disabled, or have a learning disability. It is also for children that, for example, they could be a young carer for a member of the family that has a disease. That's an example. And also children that come with little to no English, and they start primary of secondary school. They normally have a teacher that is an English teacher that helps children that have English as an additional language, and they assess how the child is doing in both languages, the mother tongue and English. You might be wondering what is the difference between education and healthcare plan and the individual education plan. The difference between the two of them is that the EIP, it's only for the school. It's only about education. While the EHCP, it involves the social worker, it involves the NHS as well. It could be CAMS, the paediatrician. They all collaborate with each other. For an education and healthcare plan, for that to happen, the parent needs to prove that the child has some very significant needs. But as we saw before, autism can be a huge health disaster because it involves so many specialists, from speech and language therapy to CAMS nurses, because of the diet that have to go to the school. It's really complex, and the EHCP, it's a great way to collaborate, for the professionals to collaborate with each other. The individual education plan, it could be also children that have other health issues, and a child with English as an additional language could have that as well. It's not only for autistic children, and the goals are to focus on the strengths, work on the weaknesses, set targets, taking into consideration the needs of a child, and their views as well. The multidisciplinary team, for example, the CAMS, well, they have the psychiatrists, they have psychologists, they have a speech and language therapist as well. They go to the special education schools quite a lot. The pediatricians also would be under the CAMS teams. That CAMS, it's a child and adolescent mental health services. The downside with the CAMS, it is that the waiting lists are very long. It can take years to get a referral. The teachers meet with the healthcare specialist in the meetings at the schools, in the individual education plan meetings. They all meet and discuss the progress. They discuss a plan forward as well. The occupational therapists, they are great to help with equipment. Some children might need some mobility aids, because it would not be uncommon for a child with autism to have some motor skills problems or difficulties walking. So they can organize a stroller or a child wheelchair, in any sort of equipment that the children need. And the speech and language therapists, they for the children that are non-verbal, they have to teach a communication method. For example, picture exchange communication system. It could be Proloquo2Go, that are apps. It's an app from the iPad to communicate, and what it does, it talks as the child is forming a sentence. All those methods that are called augmentative assistive communication, and that is for the children that don't develop language. They might help other children that struggle with pronunciation. Normally, the recommendation for children that are autistic and that are nonverbal is that the family keeps talking to them in the mother tongue in the home. In the case of my son, because he struggles so much with language, I decided to speak to him only in English, because he struggles, and I don't want to confuse him. As we said, there will be a lot of acronyms and jargon, and I think that organizing them by categories would be the best idea. For example, let's say communication, what I was telling you about, the alternative communication systems. That there is another one that I didn't mention, that's called sign along. That it's a simplified British Sign Language. The picture exchange communication system, it's basically, it's a folder with Velcro, and there are many pictures. There is a bar underneath that where the child places the phrase that they want to form. The problem with this method is that when the child is expanding the vocabulary, you need to print more pictures and laminate them. But the school helps with that. They allow the parents to come and print more pictures and laminate them. So I think it would be a good idea to have a list of the acronyms to do your glossaries. This could happen to not find an equivalent in your target language because there is such a broad vocabulary for disabilities in English that I don't think it's much in any language. So LSP in this purpose, in this context, it doesn't mean language service provider. It would be language for special purposes. We can have the glossaries, the ad hoc glossaries. There are glossaries used for a specific purpose. And you would need to include the definition, get an example of that word used in context. It's not as simple as put the word in Spanish and English, for example, or any other language combination, because it's important for you to understand the meaning of the word in case that there is no equivalent or that you need to explain to the client, to the parent of the child. And you could use these methods that are used in translation. For example, compiling a corpus. Corpora is plural. You can find text from a very good source, of course. It can be any text. So you can see the word just in context, because there are words that you won't find in dictionaries, and there are words that you will need to paraphrase. So that's important for you to understand well your topic and to do your research. Yeah, also we would have a health acronyms that we were mentioning earlier. We could place them into categories. So these are words that were used in the past, but they don't really are socially acceptable anymore. For example, sufferers, it means that a person is suffering from a disease. Retardation was a word that was used in some research papers, but now it's considered to be ableist. It does not sound good, and same as handicap. However, do not hesitate to use the word disability, because there is nothing wrong with the word disability. And autism can be a very disabling condition for some, not for everybody. And then there is another controversy with this term, that is neurodiversity, that was first introduced by a lady called Jadis Singer, but it's a sociological term. It's not really. It doesn't have anything to do with biology. And the problem with it is that it was believed to be including everybody with a neurological difference, but really this lady, she ended up explaining that she was only thinking about high functioning people and those that had Asperger's syndrome. And now she's also saying that autism it's a personality trait, according to her. So she's excluding people with learning difficulties and disabilities from this term. So it remains a little bit controversial. I hope that you enjoy my talk. I'm gonna be sending to you some glossaries because it's there are a lot of terms and there is really not enough time to go over everything. I'm leaving my email address in case you want to contact me if you have any questions. Thank you very much for listening, and I am passing over to AIT.